Now, this is a little tricky question, mind you. If you were to do delayed cord clamping, does it reduce the risk of NEC and IVH in preterm? Anybody please? Any of these answers?
Only NEC.
Okay, who's this? Who answered this question? Can you just identify yourself?
Anant Itkar.
Dr. Anand, yes. Well,
Dr. Anant Itkar. Yeah.
Anand, yeah. Only IVH you said it reduces, not NEC?
This is...
So I think both are correct. Yes to both.
No. Basically, it's yes to both. So, you're right in saying that when you do delayed cord clamping, at least for, I would even say 45 seconds to 60 seconds in the preterm, you are enabling the child to get more circulating volume, prevents hemoglobin from dropping down, so the need for transfusions comes down, neurodevelopmental outcomes are better, and of course, most important in the immediate newborn period is the risk of NEC and intracranial hemorrhage both reduce. Now, when you are attending, as you mentioned in the golden hour management, the obstetrician needs to be emphasized to kindly just help in delayed cord clamping, especially if the child is stable and is crying when the baby comes and is vigorous. If the baby needs resuscitation, then of course you don't do that at all. So this is the lesson which I wanted you to remember in your mind.